Medicare, Medicaid systems need to work effectively. How many of you are on Medicare? Anybody? Okay. One of the things we had one of the doctors speak, and they talked about this, the number of people, some of y'all are older than that, but won't even raise your hand. Okay. Okay. Some of the doctors will not take any new Medicare patients. Do you know why? Reimbursement. There are doctors that are waiting 3, 6 months and never getting paid. What happened if your part of your paycheck didn't come in for 3 to 6 months? You can't operate. And I'm saying that if they're going to hold us accountable, and you know what I found is the government, if you don't pay them on time, what do? They come knocking on your door, or they fine you, or they penalize you, or whatever's going on. And they charge you interest ongoing. So I want you to understand that we've got to do that because our doctors, here's the thing about it, have got to be reimbursed too. We need standardization of our billing systems and communications with the insurance companies and healthcare providers. I have an HSA account. I'm going to ask, okay, Government 101. Y'all know what an HSA account is? He knows. Okay. He's not 18.
I look 18 then.
Yeah. Okay. A health savings account is a way in which you buy a policy with a large deductible, okay? And you are allowed to buy that at a reduced premium because you have a high deductible, doesn't have a prescription card, doesn't have an office visit on it. And I'm allowed to put about $5,200 a year for a family into an account on a deductible basis before they get any tax. That's a good thing. And then when I spend it, I can walk over, and if you're my doctor and you say that's a $200 bill, I can take out my debit card and I can say, charge the $200. He instantly gets his money. Do you think he likes that? He can't. But here's the problem. If I have an insurance policy with a network built into it, okay, I have to get that $200 bill repriced, and I may actually, in fact, I went to the Fayette Community Hospital, my daughter had an x-ray, the bill was $700, but because I had an agreement with the insurance company, with the hospital, that bill went to $402. But do you know it took the hospital over 90 days to get me the corrected amount that I would have paid them at the time of service if they could have just given it to me? Now here's the other problem for you. If the consumer, and I believe that consumer choice is proper, you and I need to be able to know what it's going to cost. If I'm going to have an operation, I should be able to say, what's it going to cost me? You were in business, Lee. Did they want a price when you were going to pay something? Or did they just say, go ahead and do it? No, they want a price. And part of our issue is that we need, how many of you ask what it's going to cost? Dentists do it. Dentists are kidding. They won't do it. But you need to ask what's going on. You wouldn't buy anything else that way. And I'm saying that until we, the people, take control and ask the questions we need to ask, nothing's going to change. We need free market access for other states, okay, and countries. You go, you're crazy. Well, let me tell you, most of your policies will not cover you in another country, okay? But let me tell you, Forbes magazine, you need to get the article, it's interesting. A gentleman, I believe it was Wisconsin, had a crushed hip and an injury. He was uninsured. Now, most insurance, when you take it, has a pre-existing condition, so it didn't do him good if he could get insured. He had gotten a price for that hip replacement at over $50,000. Was going to have to take out a mortgage on his house in order to have his hip replaced. He got on the internet and started doing some research and found that there was a doctor in India who would do the hip replacement, and this doctor in India had done more hip replacements than any of the doctors that had quoted him over here. In fact, these guys had a whole facility set up where people could come in like a vacation and bring their wives, and they did the surgery. He had his hip replacement done for $10,500. Now that's free market. See, they want to outsource our manufacturing to where we got cheap labor. Maybe we need to do the same thing with our medical care. Maybe I need to get a trip to Mexico out of the deal. And I'm just saying that we need that type of free market process to make the prices come down. Does that make sense to y'all? Do y'all understand that? And you can get on the internet and look that up on Forbes, but it's very interesting. That's happening all over. And here's what's going to happen if we see socialized medicine. I just came back, I was in Australia and New Zealand. Both of those countries have socialized medicine, but guess what else they have? If you want anything done, you have to buy private insurance. Because you can't get the procedure, oh, well, we'll get around to that hip replacement in 4 or 5 years. And unless you have private insurance, you can't do it. Here's what happened. Government-sponsored health insurance is going to do this. Supply dies. And we've got to realize that, the resources of what's going on. Legal reform. Here's what I'll tell you. Texas is one of the states that's had some legal reform, and that is this. Tort reform, thank you. The tort reform issues. Here's what's happened, is that how big can a suit be? Now granted, here's a problem with medicine. Problem is an inexact science. Have y'all noticed that? And it requires the doctor, the patient, and sometimes prayer to change things. Okay? And I'm just saying that we have to say there's a cap. Maybe it's 5 million, maybe it's 2 million. There's some cap. It cannot be unlimited to what's going on. And where we see tort reform, what you're seeing in Texas, you saw a whole increase in the number of doctors that came in. And it's a supply and demand issue of what we're dealing with. Excess government regulations. Okay, here we go. Y'all ready? How many of you know what COBRA is? Don't tell me it's a Mustang. Okay. No, COBRA. How many of you know what COBRA is? Okay, we have state COBRA and we have federal COBRA, based on the number of employees that you have. State COBRA is not good. Federal COBRA is better. Okay, but guess what? They make, Okay. Here's what happens. The regulations of COBRA is a continuation if you terminate employment. Guess who's responsible to prove that they offered it to you? Your employer. So if you leave your employer has an obligation by the federal government to get a signature. In fact, I just got a client the other day. He sent it to the last known address. You know what? Because he didn't have a signature, the guy got injured. They're suing him for it. That's wrong from that standpoint. We need personal responsibility going on. We have another one called HIPAA. How many of you know what HIPAA is? Got HIPAA. We've got another one, ERISA. Okay? All of those things. And here's the one, is the privacy law. Are y'all familiar with privacy law? Let me tell you, that was the most frustrating for me in the industry. If you call me and you say, Marty, I got a problem with my claim. Can you help me? I could get on the phone and I could call whoever it is, Blue Cross Blue Shield, Humana, whatever it is. And I'm talking to Sally Joe, and Sally Joe has this, da-da-da-da-da. And we could get it worked out. Today, it's this. I'm sorry, I cannot talk to you about any of the matters. You know what? It's like swords fighting blindfolded. It's just hard to do. Okay? Understanding that we've got to deal with the issues that make common sense. You know the biggest words that are lies. Ronald Reagan says, "Hi, I'm here from the government. I'm here to help." Can't do it. And understanding what this does, this year I've had 3 customers who said, I am tired of the regulatory. I'm trying to outsource my payroll, outsource everything. I can't keep up with all the regulations going on. They are killing small business. And small business is what keeps this country running. It's where the jobs come from. And right now, we've got to change that. I mentioned HSAs. We've got to see some of the changes there. This is what I think has to happen if we are going to keep private health care. It is guaranteed issue individual policies for individuals. That means this, and I have a choice, because, can I give you this? I changed health carrier. Any of y'all ever had your employer change health carriers? And your doctor was not on the new carrier? Did you hate him, curse him, and call him bad names? Yeah. And I said, I was trying to save money. And guess what? But because your employer chooses the plan, you don't even get a choice in it. And I'm like this, is that companies have to come together, they need to pool together what's going on, where you and I can choose who we want, and we pay for it, and we get our employer out of the deal. Because you should not be tied to your employer by your health insurance. Would y'all agree with that? Understanding that if I have a terminal problem, until we had job portability come into play, I was stuck if I had cancer, or if I had a problem. And that helped, but it didn't solve the problem. And insurance companies should not be able to raise your rates or anybody's rates based upon their individual problem. It needs to be broad-based. That's the whole purpose of insurance. You understand that? It's a large loss. Now, in Fayette County, we just really did a good job on them in the homeowners market with hail. Of course, I saw hail that big, but I've never seen anything like it. But that doesn't happen but every 30 years. But guaranteed issue health insurance needs to be something that's going on.